Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. Just a quick note from our sponsor, Grow Solutions. We are your growth partner for busy health and wellness professionals. We work to eliminate any of the biggest headaches that your practice holds you back from enjoying practice or enjoying life when you should be away from practice. We specialize in offering frameworks and automations that help with all of the technical issues that people arise. So if you've ever said this to yourself, I'm too busy to grow, too slow to scale, and I'm too overwhelmed to fix it, that's where we can step in and hopefully help. So if you have any questions, just drop the word grow below or reach out to me on LinkedIn. Now let's get into the fun part of today's episode. I'm excited to introduce you to Dr. Mary Pardee. She is a naturopathic medical doctor specializing in preventative medicine and longevity in Los Angeles, California. She has an undergraduate degree in human nutrition and has worked in exercise physiology and performance research for the U.S. government. She holds a doctorate in naturopathic medicine from Bastyr University. And Dr. Mary is the founder of Modrn Med, a medical practice that provides medical and health services to patients via in-person consults as well as telemedicine. Her primary focus is on closing the health span, lifespan gap, extending lifespan, how long you live, and enhancing health span, how well you live. She is licensed in both California and Colorado. And for those that don't get to work with her or her team one-on-one, she's also created a course online. It's called The Truth About Supplements that debunks common myths about the most commonly used supplements and vitamins. So Dr. Pardee, welcome to the Prime Health Podcast.
Thank you, Derek. Nice to be here.
Absolutely, Mary. Thank you very much for taking the time out. Like I said, this is the Johnny Cash episode. We're a little black on black here. So we'll see if we can have fun when we go through this. So I always enjoy asking this question because everybody gets into medicine, sometimes for personal reasons, sometimes not. But what drew you to saying, okay, I made a decision, this is where I'm going to go? What got you going into medicine?
Yeah, mine was part personal journey and part infatuation with science. But my personal journey in health was from when I was a little kid. I had stomach issues. So that's kind of where it all started. And dealt with like constipation, bloating, really from the first time I can even have memories. Saw a bunch of gastroenterologists, did the whole endoscopy, colonoscopy, diagnosed with constipation, reflux, and went on a bunch of medications and just like never felt well, like never really got to a place where I'm like, okay, this is working. I feel really good about this. And by the time I was going through my undergraduate, I had an inkling. I was like, okay, this is like something that I really want to figure out. And so I ended up going to school and largely to figure out my own health issues. And I will say I figured them out. And right now I don't have any issues. I feel really good about that. And I always tell people when I tell this story, I'm an N of one. So it's like, it's not like I have like the magic, panacea cure all for everybody with bloating and constipation. But I sure as heck have learned a lot about those things. So a lot of the people that I help have constipation, bloating, and my background, as you said, is like exercise science, nutrition research, and that's like my personal passion. Like the core of it is I love science, I love biology, I love biochemistry. And so I pull a lot of that into my clinical practice where we're always talking about nutrition, we're talking about exercise science. I'm using exercise science testing in my practice. So I get people on treadmills, we're doing VO2 max tests, we're doing sub-max tests. And so I've really been able to like kind of curate like the thing that I love the most, which is really fun. So right now I see two groups of people. I see people with chronic GI issues, because that's kind of what I got my name for out of college. I went to work with a gastroenterologist for a couple of years right after medical school and have a group of people that have chronic GI issues that I help with. And then I have another bucket of people who are well or have to lose weight or are looking into hormone replacement therapy for menopause or testosterone replacement. And that's more of like my preventative medicine longevity group of people that I help with. So both of those things.
Okay. Can you share how you work with the government? How did that work for you?
Yeah, so right after my undergraduate, I had done some research in my undergraduate program, and I applied for this job working for the U.S. Army Research Institute of Environmental Medicine out of Natick, Massachusetts. And I worked in their exercise science department doing research on war fighters. And it's an incredible facility, like had all the gadgets. And as somebody who's a nerd to have like access to all of the gadgets, I was in heaven. I was like, this is like my dream job. And I stopped it much sooner than I thought I would have, because this is an actual story. My best friend at the time called me and she was like, hey, I hate my job. Let's quit our jobs, move to an island. We've never done anything spontaneous. Like we've always done like the internships and, you know, kind of going through the motions of life. And I was like, oh man, I love my job though. Like I love my job. I love where I'm at. And she's like, yeah, but we could live on an island for a year and like have fun. And I'm like, all right, let's do it. So I quit my job with her and I moved to an island, and it really changed the trajectory of my life. But I still had a great experience at that research while I was there.
So you took a big leap of faith and hopefully of fun. So it's a great story.
Yeah.
Yeah. So you brought up a good story about your personal stuff. I like when you say bloating and issues like that. I remember I was mowing my lawn. My son was outside. He's pushing his little plastic mower. I went inside and I looked at him from inside the house. He's still pushing it, and seeing his belly bloated, like he had just drank his own 6-pack of something. I don't know what it was. And I said to my wife, I said, how come we've never really noticed that before? And myself being in healthcare, my son, we just didn't really know. He was a preemie. So if my son were to walk in with me into a practice, how would it differ in your practice versus the conventional pediatrician?
Yeah. So I don't treat kids first and foremost. So I don't treat any children. And I want to normalize kids should have a distended stomach. So majority of what you see, and I don't know how your son's age or like the story or anything, so I don't know if it applies to him, but when you see the little kids run around and they have these pot bellies, right? Like their belly sticks out. That's totally normal human physiology at that age of life. And I think part of it is due to the fact that their like rectus abdominis isn't fully developed in terms of like their core muscles, but there's a lot of things at play and it's just completely normal. So people will often say, I wake up with a flat stomach, and then as the course of the day goes on, I have breakfast, I get bloated, then I have lunch, I get more bloated, then I have dinner, then I get more bloated. And by the time nighttime comes around, I feel like I'm 9 months pregnant and I'm super uncomfortable and it's affecting my quality of life. So the cues there are that things are getting worse and worse and worse as the day goes on, and it's affecting somebody's quality of life. Both things that we should be like, okay, maybe we should look into this. But on the flip side, what's normal, what you don't have to look into, is that after you eat a meal, your stomach is going to be distended a certain amount because that food has to go somewhere. So if you say you eat a softball size of food, you're going to have that amount displaced in your stomach, plus a little bit more because of the air that's produced with fermentation of carbohydrates. So it's just going to produce some gas in the intestines and stomach as well. Ideally, what should happen is over the course of a couple hours, that starts to disperse down the intestinal tract and you start to digest your food. It just goes away largely. And so you'll notice, okay, I'm a little bit distended after a meal and it kind of goes away. And then I eat another meal and I'm a little bit distended and it kind of goes away. But you don't end the day uncomfortable and like feeling like you're 9 months pregnant.
Okay. So a 50-plus-year-old person like myself complains of those situations. I go to my GP and, I get a purple pill. I go to see Dr. Mary Pardee of Modrn, Med, and all of a sudden I get something different. So what's that difference in the protocol of how I would be treated in your office versus a general practitioner?
Yeah. And maybe not. Like, so I can't say what we would do, but let's say, you come in for bloating. First of all, we're going to spend an hour with you. So that's usually the first thing that's going to be different. So first appointment's always like an hour and a half long, getting your full medical history. How did this start? Like really just combing through things. You want to know what are your especially with bloating, you have to know about the bowel movements. So like how many bowel movements you're having per day, what do they look like? We're going to show you the Bristol stool chart. We're going to ask you all the questions. We're going to talk about your diet. We're going to talk about exercise. We're going to talk about sleep. We're going to talk about stress reduction. We're going to talk about your relationship with food. Are you avoiding any foods? Are you exhibiting any controlling or avoidant behaviors around your health? So we're really going to dig a lot deeper than most GPs. And then depending on the gastroenterologist, we may dig a little bit deeper than them as well. And then we'll do testing. And so depending on your symptoms, we'll order blood work and or imaging if there's any like abdominal pain. And then we'll do potentially like breath testing for bacterial overgrowth if that's indicated with bloating. And then your second appointment, you come back, and again, we're going to meet with you for 30 minutes to an hour. We're going to review everything and then for you to plan there. We differ from other functional medicine integrative practices in that we do prescribe medications. So I am not somebody who thinks that medications are bad for you. I think that a lot of them actually can have a huge utility to them and be really helpful for patients when used appropriately. You may get a medication from us that you would get from your gastroenterologist. I think what really differs us from conventional model is the time we spend with patients and how holistic we are, where we're not just going to prescribe the med and that's it. We're also going to talk about stress modulation, diet, exercise, lifestyle, your thoughts and beliefs around food.
Okay. You said something interesting. Do you mind if I ask, can you go a little bit deeper on where you said the breath test?
Yeah, sure. So there's something called the lactulose breath test. And lactulose is a carbohydrate that's not digestible in the human tract, but bacteria can digest it and they produce gases in response to that. And so when somebody comes in with bloating and gas, it's a very common test that we will run, which is going to look at how much methane, hydrogen, and or hydrogen sulfide somebody produces in response to a controlled amount of that carbohydrate. So we're able to see, based on the results of that test, does somebody have an overgrowth of methane-producing archaea, hydrogen-producing bacteria, or hydrogen sulfide-producing organisms? And based on the results of that, then we can treat them for the methane or hydrogen overgrowth that's there. And there's a few ways to treat that, but that's intestinal methanogen overgrowth or small intestinal bacterial overgrowth are the two things that we're looking for.
And with that breath test, do people notice that because of a change in odor?
Odor, like smell?
Yes.
No, it's not usually a change in odor. Some people will say that hydrogen sulfide, when you have high levels of that, they'll have like a sulfur smelling to the gas that's there, but that's not always the case. Really, the key that we're using that test is people are complaining of excess bloating and gas.
So what are some misconceptions that people have about a naturopathic medical doctor that you experience on a day-to-day basis?
Yeah, I think there's a bunch of these, but people often confuse us for homeopathic medicine, and homeopathy is something that I've never practiced in my life, so I don't know if I'll do this justice in explaining it, but it's those little like white sugar pills that have like a fraction of a molecule on them, I believe. Okay. And that's as far as I can go, but it's completely different. They just sound somewhat alike. So homeopathy and naturopathic medicine are not the same things at all. Other misconceptions are going to be that naturopathic doctors aren't evidence-based and don't prescribe medications. So I do prescribe pharmaceuticals in my practice, and I'm 100% evidence-based. So it's like one of my North Stars in medicine, and it's to say, do we have research around this? If so, what is the research? What are the risks? What are the benefits? And what's the best thing for the patient? For me, I went into naturopathic medicine because I really think that we should have a more holistic view of how we treat people. Like we should be talking to everybody about nutrition and exercise, which are why, that's the foundation of my education before I went to medical school. And I think it should be like a cornerstone of our treatment versus like, exercise more on the way out the door kind of thing. It's not a problem with our doctors. It's definitely a problem with how our system is designed. Those are some of the things. I think there's probably a lot more misconceptions, but those are the big ones.
So when somebody comes in that may have a misconception or aren't sure, what do you do to build trust with that patient?
Yeah, one of the things I love about how I practice is I get so much time with people. So before someone even becomes a patient, I spend 30 minutes with them on a call to make sure, am I the right fit for you? What questions do you have for me? And what it's going to be like working with me. So I do a completely complimentary 30-minute intro call to make sure we're a good fit for each other and set expectations too. I think the integrative medicine space at large does people a real disservice in some aspects, because what I've seen is people come to me after they've seen another functional medicine or integrative doctor, and they come to me being like, everybody's told me that they could heal me, and I still have all these issues and I'm really bummed. And I'm like, okay, well, the last thing I'm going to tell you is that I can heal you, because I don't know if I can. Like, I don't know how these people think that they can say that about like anything. I can set expectations, meaning like, okay, I think that based on what you're telling me, I think I can really help you improve your constipation, but I don't know. Like, it could be one of the few people that I can't help. So for some reason, integrative medicine makes promises that they can't fulfill a lot of the times. And that's concerning to me, first of all, but it's also just something that I like to set the bar a little bit differently at and say, here, I'm just such a straight shooter. I'm from the East Coast. So it's like, I tell people exactly how it is. I'm going to tell you the same thing I would tell my mom, my dad, my brother. I'm not going to sugarcoat it. And if I don't think I can help you, like the number of people I've told, like, I don't think I'm the best fit for you. Like, maybe you should look into seeing Y or disease.
Yeah. That brings up a great point, that last segment that you stated. So are there someone's original condition coming in, even though they're seeking improvement, there are times in which you're going to turn people away. So what's someone's overall health and their lifestyle? How does that play into the treatment that you provide?
Can you ask the question in a different way?
Yeah. So if I walk in that I may look healthy, but I'm smoking, I'm drinking consistently, I may enjoy some recreational drugs, if somebody is doing that stuff, that's counterproductive to the results you may get with them. So how does someone's overall health stop them from getting the results that you think that you can get as a straight shooter from being the physician?
Yeah, I mean, so we're getting all that information. During our first call, I'm going to ask you about smoking, drinking, all of that stuff. Once I have that information, we're just going to have an honest discussion about it. And say, let's just say you're having 6 drinks a night, and you're trying to resolve reflux. I'm going to set a really obvious expectation that it's probably not going to happen unless we're using like high doses of PPIs, continuing to drink that much. So it's just having honest conversations with people about, hey, your lifestyle things are definitely impacting your health, and it's going to impede your ability to heal if you don't stop throwing gas on the fire, right?
Okay. So can you explain how, like when functional medicine started kind of hitting the market a little bit more, people understanding that it was always just about, are you gluten-free, or it's about SIBO. So when somebody says, oh, I've got gluten allergies, how would you address somebody when they come in, to your office that way?
Yeah, this is another great topic that I like talking about, because I think that gluten allergies, gluten sensitivities are so overly diagnosed in the integrative functional space. I've done a few podcasts about this, but gluten, I don't think is bad for you at all. There's actually some evidence that shows that people who eat gluten versus people who do not eat gluten, the people who eat gluten are healthier than the people who do not eat. And so most of the studies that people pull from when they talk about demonizing gluten, and of course, we're not talking about people with celiac disease. Like celiac disease, I don't think they should be eating gluten. There's good evidence to support that. The general recommendation of gluten is inflammatory, gluten is bad for you, I think is really a conversation that needs to be had again in this space and pulled apart and really analyzed, because I just don't think there's any evidence to support that claim. There is something called non-celiac gluten sensitivity, and that seems to be like a real thing that can happen, where you just have a sensitivity to gluten. But the percentage of people, when they do a randomized control, like double-blind trial, where they give people pills that either contain gluten or don't contain gluten, and then they do a crossover, meaning they switch those groups and give them either placebo if they got the gluten before, or the gluten if they got the placebo before. There's a really interesting one of those trials that shows that the people who say they're sensitive to gluten versus the people that truly had a reaction when they ate the gluten but didn't have a reaction when they have the placebo is very, very small. So we're just not great at being able to tell if something's affecting our body, because there's so many variables in nutrition.
Okay. So you've been in practice for some time now. In the last 3 to 5 years, have you noticed a demand for somebody looking for a provider like yourself?
Absolutely. People just want to be heard by their doctor. They want somebody who actually spends time with them. They want somebody who does the research for them. One of the things that I tell people is like, if you become a patient of mine, you can offload your health research to me. Somebody sent me a list of like, hey, these 2 supplements, do you think that I should take them? And instead of me just saying like yes or no, I did a full review of the literature on both of these based on what they were looking to do and say, hey, this is what it says. I don't think you're going to get a benefit, but hey, this one may help you with X, Y, and Z. Here's the dosing. Here's the one that I would, take if I was going to do it for you. So I think people are just looking for a personalized, individualized, more in-depth approach to their healthcare.
Yeah. That's a great point. It speaks to what one of my first jobs out of school was working for an orthopedic surgeon. And the patients would come in and he would be back in his office dealing with his home that he was building on Michigan Avenue. And the patients would be like, well, when he comes in here, he just speaks so quickly, doesn't listen to me. And I would see it happen so much. And then I would tell the patients as I got to know them better, I said, well, once he comes in, just do me a favor, get off the table and stand in front of the door and ask all of your questions. Let your questions be answered. And he would come out and he said, why do these patients ask me so many questions? And I said, Doc, because they want answers. They just don't want surgery as an opportunity. And that's when you go to an orthopedic surgeon, they have a script and they have a scalpel. Not many other opportunities are inside of there. So from somebody that's coming in to see you that may have these gut issues or SIBO issues or the common characteristics of someone coming in, do you have a protocol that you follow for them, or is each person unique to themselves?
Yeah, I mean, I have protocols for certain things. So like if somebody has, let's just say small intestinal bacterial overgrowth, and I have a pretty standard protocol for that. But everybody comes in differently. 'Cause it's, people come in and they have constipation and they also have SIBO, or they have diarrhea and they have SIBO. Those are going to be 2 different treatment plans if somebody's constipated versus they have diarrhea. So in the end, I'm treating the person first and foremost. Some people come in with bloating and all I do is treat their constipation. We're not even looking at overgrowth. So it really depends on how the person presents, what we're going to do. And that's why it takes an hour to get to know them and what's actually contributing. If somebody has irritable bowel syndrome that's constipation predominant versus idiopathic constipation, those are 2 different treatment programs because they have a different etiology to what's actually going on there. Somebody has dysenergic defecation that looks like constipation. That's a different treatment than just regular constipation too. So I think getting a real diagnosis of what's going on is the first step to figuring out, okay, what's going to be most useful for this person.
Okay. So in your practice, what do you feel makes you successful as a business owner?
As a business owner, that's a great question. I think what makes me successful, well, I think there's a few things, of course, but one of the things that comes to mind is integrity. Like the number of people when I do those intro calls with them that say like, thank you. Like I feel like somebody's actually telling me what's like behind the curtain for the first time. Like they're just like telling me how it is. If you're a new patient and you come to see me, I don't profit off of any supplements that I suggest for you. So I take that bias out. And I think that builds a lot of trust with people that if I'm prescribing the supplements, because I think you're really going to benefit from it versus because I'm going to make money. And in the integrative space, the majority of people are making money off of what they're prescribing. And so I think it's just really having trust and integrity with my patients that sets me apart. I think there's also things like I love going on podcasts and I love talking about health and I love conveying like research to the general public. So I think that's also.
From all the successes you've had personally and professionally, what are you focusing on in your professional realm right now in practice?
It's those 2 things. So my bread and butter is helping people that have chronic GI issues. And then I have this other big group of patients that are concierge patients that want to stay healthy, want to prevent disease, and want to live a really long time. So that's like my preventative medicine longevity bucket. And those are my 2 main focuses in health and medicine right now. And it's one-on-one patient care is what I'm focusing on. And I do have a couple of business ventures on the side, but those are secondary.
From the longevity perspective, how does that differ from the ones that are like, can you give us an idea of the big difference in how that looks from a health perspective versus a fix perspective? People coming in are looking for a fix. Other people are looking for expansion of their life.
Yeah, so I actually see more people in my preventative medicine longevity bucket than the chronic GI issues at this point. And people come in and they don't have concerns. So they're not saying like, hey, I've got constipation, or hey, this or that. They may say like, I'd like to improve my sleep, my energy is a little bit lower, I want to lose, 20 pounds or maybe even more. From them, I'm taking them through a process of here are the biggest things that I think that we need to cover in terms of identifying your risk for chronic disease over the course of your lifespan. So the real question I'm trying to answer is, for you, Derek, what is the thing that you're most likely to die from based on your family history, your current lab work, where's your cholesterol lab, where are your inflammatory markers at, what do your hormones look like? Where is your greatest risk and how do we mitigate that? And then how do we look at, okay, well, if we've mitigated that, what are the other most common things that people die from, and how can we reduce your risk for those things as well? My biggest focus for this group of people is health span, like your quality of life while you're here. I don't think people want to live to 110 if the last 10 years of their life are in bed, right? So there's so much we can do to improve your quality of life while you're here. And that's where I focus the majority of my time on.
Yeah, love it. Well, I can tell from how you speak, you have integrity. I can tell how you practice that the ethics are there. So how do you have challenges in the business that present to you every once in a while?
Oh my gosh, yes. Like if any business owner says no to that, I don't believe them. Of course, it's the same as, I think people forget, like medicine is a business. Like we own a business, and it has to be profitable, right? So we've had issues with profitability over the years that we've had to make changes. Yeah, you're managing people too. So there's always going to be things that come there, and I'm always figuring out how to be a better leader when it comes to business. And I know that's still an area that I can improve upon. Yeah, I mean, I could go into more. Whatever questions you have, I'm happy to answer. Because it's challenging, especially when my strong suit is science. I'm really good at science and medicine and those things that I know how to do really well. And then there's finance, and there's marketing, and then there's all this other stuff to medical practice.
It's just like success in life. When you finally achieve it, nobody looks at the struggles that you went through, and people will walk in the door. They have their own problems. They don't know what problems you have, and you've got to drop those on the wayside and take care of that patient. It's not always easy. A lot of the times in practice, there's a lot of psychology that goes into it versus just trying to find the fix or find the extension. Yeah,
Absolutely.
So is there any truth to that?
I'm not working on a book right now. I'd be surprised if I don't write a book in the next 5 years, but I'm not currently writing one.
Okay. And because your knowledge base that you have, do you ever go out and speak at universities or speak at conferences, anything like that?
Yeah, absolutely. Public speaking is one of my favorite things. I've got a few this year that I want to do.
Okay, wonderful. So what is the vision of your business in the next 5 years?
Yeah, my vision for my business is I really enjoy working with people one-on-one. And I have another associate who works with me as well, and other doctors, these patients one-on-one too. And that's the vision. So I used to have other visions for the practice and wanting to go like nationwide, and I don't want to do that with my practice right now.
Okay.
So I really just want to keep cultivating really close one-on-one relationships with people and helping them with their healthcare. I think if I were to talk to myself who started the business in 2016, like that younger version of me, and tell her one thing, it's that you don't have to scale every business. Because at that point, I wanted to scale the business and make it something a lot bigger. And I think depending on what you really want out of your business, like it may or may not be the thing for you. And so I started down that route, and I quickly realized that I have no interest in that kind of model for my personal practice. Not to say I won't create a business that scales later in life in a different way, but for my practice, I'm really happy with what it's at.
Good. It sounds like you know what you want. You're goal oriented as well, I can tell. So what would you say, could you share a story of a success story of your patients that have come in and they may have struggled with XYZ provider or just didn't go to a provider? Like, can you share one of your successes with us?
Yeah, absolutely. I have a woman who I've been seeing for years now, I'd say like three or 4 years. And she came to me with the primary complaint of low energy and inability to lose weight. She had seen many other people in the integrative space, and they had told her all kinds of different things. They put her on supplements, they had put her on peptides, they had talked to her about diet, things like that, put her on like anti-inflammatory diets, elimination diets, all those things. And I was the first person that spoke to her about medication, like assisted weight loss. So using prescription medications for weight loss. And this person under my care lost over 100 pounds.
Wow.
Reversed PCOS, reversed insulin resistance, reduced her cholesterol, and reduced her cardiovascular disease risk by like 50%. Now goes out and like socializes with people, which she didn't do before losing the weight. Just a different life, I would say. I think that's a great example of like when you demonize medications to the extent and I even had to talk to her about it. I was like, hey, medications aren't bad. Like, you don't have to be helpful. And I talked about obesity is a disease, and there's things that are going on from the brain level that change your appetite and things like that. So I almost had to rewire her beliefs around medications to get her on board with it. And I mean, to this day, she's like, thank goodness I didn't see like another integrative doctor who just gave me another supplement that did nothing. She was really disheartened by the time that she came to me. But in my mind, true integrative medicine is using pharmacology when you need it. And also, we talk a ton about nutrition, exercise. How are we going to implement these things? How are we going to make it so this weight loss is sustained for the rest of your life? How to make sure you have as much muscle in your body as you can to support your bones. And so for me, that's the big difference between integrative medicine.
From a differentiator standpoint, you've had your undergraduate school was, exercise physiology, essentially. You appear to be still doing that work, which is fantastic. We always should be healthy. And then from the shift in the work that you're doing now, what do you say makes you different in your community from other providers? What's your differentiator as a healthcare professional?
Yeah, I mean, I think that's one of the big ones is my background in nutrition and exercise science are so strong that I think a lot of people know that exercise and nutrition are important, but they don't really know how to help people. Like, what are the actual tools? What does it look like to guide somebody through diet changes for weight loss or for muscle gain or for body fat reduction? Like, what are those different plans actually look like? And a real focus on actual prevention. So how do we prevent chronic diseases in people? There's answers to that question. Like, we know how to prevent those things. And of course, we're not going to be able to prevent everything, but like, why don't we do the things that we know that are evidence-based? So that's another big piece is I'm super evidence-based. We have so much that we know. And this is actually why I decided not to go the PhD route, where there's so much in research that we know that's not getting applied to clinical practice yet. Meaning that there's researchers out there finding out all of this information and how do we prevent things, but it's not getting implemented at the doctor's level yet. The majority of that is just people don't have time to do all of it, and I have the gift of time with my patients. But it's really just implementing the things that we know are tried and true and have evidence to support them.
Yeah. Do you think any of that, I don't want to get into politics with this question, but do you think there's any of that from a pharmaceutical or a medical school perspective that you're not sure if they really want to give better answers out versus keep the cash cow coming through their drugs and through the hospitalization of people?
I think there's an issue with big pharma. I don't think there's many doctors that don't think that there's any issues with big pharma, but I don't think that it's the same way that we're kind of talking about, where doctors don't make money prescribing medications. Most of the doctors that I know just want people to be healthier. They just don't have the time to spend an hour talking about nutrition, nor do they have the education. So medical school itself doesn't give you a ton of education on nutrition. I luckily had my full bachelor's in human nutrition. Same with exercise. Most doctors don't learn about therapeutic use of exercise in medical school. Like, what does it look like to have healthy levels of exercise? How much should you exercise? What type of exercise? How many reps, sets? How do you build an exercise plan? There's all these components to it. So I think it's just that doctors weren't trained in exercise and nutrition as much as they could be. Not that they don't think that it's helpful, but yeah, in terms of like, of course, there's issues with big pharma, but I don't think it's a withholding of information that they want people to remain sick, because it's more like you only have 7 minutes with a patient. You have to go through their medications and side effects. You just don't have time to answer all of those things. I just don't see that model being effective in the long term.
Okay, before we wrap this up, just 2 last questions here. So how can people get in touch with you? I'll share as many of the social links as we can inside of the show notes, but how would you like someone to reach out to you?
Yeah, so if you're interested in actually becoming a patient, the best source is our website. It's modrnmed.com. It's modrnmed.com. So there's no E in modern. And there's a button right on the website, book a complimentary intro call with either myself or Dr. Sarah Williams. We work on 2 different pricing structures. So depending on how much you want to invest in your health and how much time you want with your doctor, that's going to change how we work with people. And then if you just want more information and like education from me, my handle on Instagram is at dr.marianpardee, and I'm on YouTube. I just give out free educational content there.
Okay, love it. Thank you for sharing that. And again, I'll make sure I share that in the notes. Is there any question you wish I would have asked that I didn't, or is there like some parting words that you would like to share, the wisdom from Dr. Mary Pardee?
I love that you asked me that. I think I did it. The one thing I didn't mention is I have a podcast as well. It's called the Modrn Wellness Podcast. And I talk about what I consider the most important topics in prevention. And yeah, check. And thank you for having me today.
Yeah, you're welcome. My pleasure. So Dr. Pardee, I just want to say thank you very much. You bring a unique blend to your practice and to your patients, and I think the patient benefits from that. And don't be too hard on yourself that you are kind of nerdy, if you wish, because I think most people really need that. They need somebody that's on their side that is looking out for them. And you're sharing that when you just said, a patient said, what about these 2 supplements? Somebody would say, well, where did you get them from? GNC, they're probably good. That's not, quite where you want to get those from. So I always ask our listeners, if you enjoyed this, of course, share it. And I don't mean for my growth or your growth. Yes, yours more than mine, but I really do mean for your friend or family member that could learn from this. What you offer, people need to get healthy. We have a lot of sick human beings on our planet, and we can only do it at one at a time, or those that find us. So when we can't do what we can to find it, we ask that you help people and push them in the right direction towards great physicians like Dr. Pardee. So please, of course, subscribe to this and subscribe to Dr. Pardee's podcast. I'll give you that information as well. If you're watching this on YouTube, of course, hit the like button and the bell so you're notified of it. But so until next time, remember that the true wellness is a journey. We're all in it together. Now, whether you're taking charge of your own health or you're guiding others in every step of the way forward, it matters. I just ask you, take care of yourself. Self-love is important, and we will see you next time on our next show. Take care.